Hello, welcome to the Iyer Clinic video series. Today is episode number 18 and we're going to talk about dizziness. Dizziness is one of the most common problems that we get in the office on a regular basis, and the symptom is scary to most patients, justifiably so, because typically they'll come and tell me, I woke up this morning, I got up out of bed, and doctor, when I got up, the whole room was spinning. I could barely sit at the edge of my bed. I had to fall back. And when I moved my head in any direction, whenever I move my head, I get this dizziness, and sometimes it's nauseating. I'm scared. Am I having a stroke? Am I having a heart attack? And so on and so forth. Fortunately, most episodes of dizziness is traceable to a simple problem in the ear, and it's actually due to a problem and irritation in the balance organ in the ear. And behind me is a schematic of the ear. You have the external canal, here, and then it goes on all the way to meet the eardrum. And in the eardrum, behind the eardrum, is the semicircular labyrinth. And if I make this all go away, you have a blown up picture of the labyrinth, which I rotate in 3 dimensions, and you can see that it has 3 semicircular loops. You have a horizontal loop right here. You have a vertical loop in one axis, and then you have another loop on the opposite axis here. So you have an x-axis, you have a y-axis here, you have an x-axis here, and you have a z-axis on the other end. And the interesting thing in this is, if you were to take a cross section of one of this and blow it up, you will get something like this. A tube, and within this tube are millions of tiny hairs. And these hairs are all connected to a nerve fiber. And this nerve fiber goes to the brain. And inside this tube is fluid. It's kind of half filled with fluid. And when the head moves, this fluid sloshes from one side to the other. And when it sloshes back and forth, these hairs wave back and forth like grass in the wind. And each time the hair moves, there is an electrical signal that goes along this nerve to the brain. And the brain is getting this information in stereo from both ears in all 3 axes, X, Y, and Z. Imagine a gymnast, and the gymnast takes the spin and is spinning through the air, and the brain computes through the input that it gets from its labyrinth. It computes the gymnast's position in space, and just when they land, it activates the right muscles to maintain balance. Imagine the speed with which the brain has to work to compute that. Now, what happens in this dizziness example is that one of the labyrinths gets irritated for some reason, either infection, viral involvement. Regardless, it is irritated. And like an irritated cut on the skin, if you place the same amount of pressure, it gives 10 times more stimulus. Like that, the irritated labyrinth on one side gives 10 times more signal to the brain compared to the other side when the head moves from one side to the other. And this confuses the brain and makes the brain feel dizzy. And the brain responds to it by making the eyes move and gives you the entire sensation of dizziness. So what do you do for this? There are several maneuvers that we can do. There's the Benign maneuver, and there are certain maneuvers that enable the labyrinth to attenuate to this irritation. There are medicines too. Meclizine is a common medicine that is given, and when you take this medicine for about 2 to 3 weeks, typically the irritated labyrinth subsides. When the cause of the irritation is an infection, then the infection can be treated. But 9 times out of 10, benign positional vertigo. It's called benign because it is so. And it's positional because it changes, the vertigo comes on with a change in position. So benign positional vertigo is by far a self-limited condition. If it persists beyond 10 days, typically we send the patient to an ENT to get a more detailed evaluation. This is Dr. Iyer, and you're seeing Iyer Clinic video. We are part of London Medical Group, and we do primary care. Come see us any day, and you can see what we can do for you. Thank you for joining me today. We'll see you again soon.